Have you ever wondered if Pilates is safe during pregnancy? I had the pleasure of talking with Alison Marsh, founder of Pregnancy Pilates Impact, to answer this question and so many more. Alison's mission as a Pilates teacher and educator is to empower other teachers to confidently, courageously, and competently guide and support pregnant and postnatal women. She offers a comprehensive and uplifting curriculum to Pilates teachers, ensuring they're equipped with up to date, research based information and strategies. By integrating these with the timeless principles of the Pilates method, Allison aims to reach and support the women who need it the most in their communities. Join us as we dive into Allison's inspiring journey and her transformative work in the world of Pilates and pregnancy. Welcome, Allison. I'm so glad that you're joining me today. I'd love for you to share a little bit about how you got started with Pilates and what motivated you to become a Pilates teacher.
Okay. Thank you for having me. I'm excited to share all of this. So basically, I got into Pilates. I was a dancer. I was taking the dance education bachelor at Bachelor of Arts at the University of Nevada, Las Vegas. And I realized I probably wasn't going to be a professional dancer. So the part of the track of that bachelor is Pilates. So you learn mat, equipment, the whole thing. And so basically you're certified to teach Pilates. So while I did end up doing some, it showgirl stuff here here in Las Vegas, I taught Pilates for a lot of that time. At the same time, I was going to social work school. So I have also a bachelor's in social work. So I'm doing social work, I'm dancing, I'm teaching Pilates, and I'm thinking I'm going to be a social worker, right? Like the Pilates thing, dance thing, like that's just like temporary to make some, a little bit of side income. But social work, that's going to be my career. And I had two experiences of having to take kids away from their families. And I was like, yes, this is not for me. So I also, it's incredibly stressful type of a career. So, talking to my husband, we wanted to start a family. I'm like, where's the most flexible? What can I be the most flexible with? And Pilates was that answer. So that's how I started to regularly teach Pilates. The way I got into pre and postnatal is me and my husband were trying to get pregnant. So I was doing all of the research, every book I could get my hand on, every course. And at the time, there were no pre and postnatal Pilates courses. There was a book by Carolyn Anthony. She had the only book out there that was specific to teaching teachers. But there was nothing else. Everything else was very general, right? Like I think there was the stroller fit or something like that at the time, things like that. So I'm getting all this education, not getting pregnant, but my master trainer, my mentor, Dolly Kellepez, who is the one who certified me, she asked if I would build a pre and postnatal course to piggyback off of her DK body balancing comprehensive certification. So even though, I hadn't been pregnant, I had all the information, I had somebody else help me that had been pregnant, and we created this course and we were teaching it. And like 2 years into it, I still had not gotten pregnant, and I couldn't just from a like imposter syndrome, whatever, I couldn't teach other teachers to do this if I didn't have the experience. And it was also very personal to me. So literally I would have pregnant clients and be in tears, like trying not to, because I wanted to have a pregnancy and have a baby, have all of that, right? So I'm like surrounded by it all the time and it's not happening. And I would have been fine not to have that, because we have two adopted beautiful children. And so the story goes like this. In summer of 2014, I take all my books, everything I'd created manuals, all back to Dolly's office. And I said, I can't do this anymore. Find somebody else to do this. I can't, I don't feel like I'm providing the most concrete information without having had the experience. It's all theory at that point, you know? And so now I do want to preface this with especially today, you don't have to have the experience to teach to teach pregnant women. I mean, all we have to do is say male OBGYNs to it's like, I mean, you know what I mean? Like, you don't have to have that experience. I have tons of teachers in my perinatal Pilates specialist program that's one of the reasons they join, is because they haven't been pregnant and they want to know. But I felt like I needed to. So basically, take all the stuff back, and nobody's doing anything with it. Of course, like, nobody's going to like pick it up. And I mean, it's my thing. Like, I created this, right? So I said a prayer, and I have it in my journal. I said, God, if you want me to teach this, I want to be pregnant. I want to have this experience. That was like in the beginning of November of 2014. And I was pregnant the next month after 8 years of infertility, unexplained infertility. That was it. Like, I was like, okay, I guess and I haven't been pregnant since. It was this just one time miracle that I always say, it's like a me and God's business plan that, my son's almost 9. So that is how I got into what I'm doing. My passion, though, on the other side of that is, I always say that's the spark and the fire that keeps what I'm doing burning, is that we have an incredibly underserved pre and postnatal medical support for this population. So OBGYNs are still not helping women. There was actually a research that came out on this, that they are not educating women on what is going on with their bodies. And therefore, women go into pregnancy and out of pregnancy with fear, with not understanding. Doctors telling them that within 6 weeks they should be fine and back to what they were doing before. And then women are like, something's wrong with me, because obviously that's not happening. Now, since then, they've extended that to 12 weeks, called the 4th trimester now. But even then, it's not the case for a lot of women. So, and then I love Pilates teachers being able to nurture them and give them an experience of positivity in a program, because I'm sure, yep, there are so many negative experiences that teachers have with training programs where they're just not, it's all about learn these exercises and do them, and you're not really a person. So I really wanted to, and I feel like that all comes from my social work background, just like a deep caring for teachers and what their experience is. And then, of course, they're going to bring that to the pre and postnatal women. And I feel like it's a ripple effect in this world of just positive impact on generation after generation, if we can have the support for pre and postnatal women. So that is my story. That's why I continue to do what I do. As Beth knows, with online, 100% online programs, the ups and downs, and the want to quit and don't, and it's that passion and the focus and focusing on helping that keeps me going.
There were so many gems in there, and I wanted to circle back to where you began, because I think I knew this, but I also forgot about it, because we've known each other for quite some time now, that we have a parallel way in which we started engaging with Pilates and also teaching Pilates. And that is not through the typical experience, which is you go to a Pilates studio. Myself as well. I started in the university setting, and Pilates was definitely that side note. Interestingly enough, I started underneath a dance program, and I thought I was going to be a health educator. That's what I was pursuing my degree in. And like you, that having that work in social work, how that's helped you be a Pilates teacher, having that knowledge in health education definitely has helped me be a Pilates teacher as well, especially now when we think about course development in the online phase. So it's one of those elements that's so interesting because as I'm getting to know like kids who are looking into going to college,
Mm.
there's so much pressure nowadays, and this is a side note of our conversation. There's so much pressure to like know what you want to do, and what we have both dedicated our lives to at this point. I didn't even know about in high school. It
Right.
wasn't until I just started trying something new, and even as I was moving with it, I never envisioned that 20 years later, for both of us, it's over 20 years, that we would not only still be a Pilates teacher, but now also teach Pilates to other people, yes, in much different ways. And I love that you focus on the perinatal population and also having a positive experience for Pilates teachers, because that's an element that I'm surprised is not included in all programs at this point. For instance,
Yeah.
I was having a conversation with someone who was interested in the Pilates mat teacher training program through Trifecta Pilates. And she goes, well, I got off a call with someone else and they said, just expect that you're going to cry throughout this program. It's going to be really difficult. What? No. Like, yes, there's a learning curve to being a Pilates teacher, going from Pilates mover to Pilates teacher, but I don't think that we need to normalize that we're going to get so frustrated with the
Yeah.
experience that we're going to try. Instead, let's have this be empowering, not only for our clients, but for Pilates teachers as well. Um, so thank you so much for sharing that story. I mentioned a term that I actually learned from you many years ago, and that is perinatal. And I'd love
Yeah.
for you to explain that maybe for people who aren't familiar with the term.
Sure. Yeah. I just learned that, well, it was like 2019 or so. Dr. Sinead Dufour. She is she's a pelvic health PT, and she's in Canada and has opened up birthing centers. It's kind of like an everything birthing experience with Pilates, PTs, birth, like doulas, and it's called The Womb, and they're all over Canada. And I started uh, working with her because she had this holistic idea around teaching pre and postnatal women. And she was using that term. And what I had always understood it to mean was right up to before you give birth. And then that's how it's used usually, like medically, or at least like that very close time, like before you give birth and then right after. And she was describing it as the first year, or the full pregnancy, and then the first year postpartum. And so and then, just in general, when I explain what I do, instead of saying pre and postnatal, it's just easier and shorter to say perinatal. So, but it's funny that, yeah, a lot of people don't know that term. I actually had a friend who had sent out an email with that term to a bunch of Pilates teachers, like inviting them to a class. And somebody messaged her back correcting her. It's not perinatal, it's prenatal. And and it's like this whole thing, like yeah, like I guess we need to educate on what that word actually is. So that's what it means all through pregnancy, first year postpartum. That's how I use it.
And I love the expansion of that because, as you mentioned prior, like when I gave birth to my children, it was, really nothing for 6 weeks. I would go on walks with them, but they also l- gave me a list when I walked out of the hospital. And one of the exercises, like an introduction back into exercise, was actually what we know in like Pilates lingo as the roll up. And I looked at it and thought, there's no way I'm doing the Pilates roll up exercise even after resting for 6 weeks. Like, we need
Yeah.
to focus on breathing and more stability work and really easing back into that so that I don't create any dysfunction in my body. Fortunately, I had already taken a perinatal class before I was pregnant. And so that informed my choices for my personal movement practice, both during the pregnancy and also after. But I love that you mentioned a year because you talk about this a lot, this bounce back culture that we live in. And we hear this from a lot of our clients, whether it's someone just had a child or even people who have recovered from surgery or illness, like they just want to hit those workouts hard again.
Right.
But sometimes that's not going to be optimal for them. And what I hear so often, and I see this a lot on Instagram, and I know you're really frequent on Instagram. You do a lot of amazing education videos for Pilates teachers there, is so many myths are perpetuated. For instance, if you've had children and you sneeze, you're just always going to leak and have incontinence for the rest of your life, and it's going to keep getting worse. And I just shake the phone at that time because we know it's not true. We know that um, that there's actions that can be taken. So I'd love for you to just maybe highlight that a little bit more.
Yeah, sure. Okay. So, yeah, the bounce back culture, get your body back, all of this, it's actually proven to be destructive to women. They did a study where they took a group of women and they did a poll with them before they went into an exercise class, like a confidence poll, how they feel about themselves. One side, the class included uh, appearance focused language. So blast that fat, make that booty smaller, fit into that swimsuit. And that's what they were doing on this side. The other side, they used function focused, where they talked about getting stronger, being able to carry their kids, things like that. And what they found was, and then they polled the women when they came out, and the women with the appearance focused language got a lower score than when they went in with the confidence level. So they felt worse about themselves. And the women that had the function focus felt better about themselves. So straight across the board, and also very sadly, suicide is the number one cause of death for postpartum women in their first year. The leading cause. And I mean, I'm sure you see this stuff, if you're passing through the news, these, that they, kill their children. And I mean, this is a real thing. And the the pressure to live up to an expectation that someone has created, because it's not real, is that prevalent. And one of the issues is, yeah, just that stress of having to bounce back. So what we know now is that it really takes at the least 6 months, like at the least. And that's if you're not breastfeeding anymore. Because it's so funny, these things. um, that yeah, so through breastfeeding, relaxin is still present, and women have to still take it a little bit easy because they're not quite back to, instead of the body, instead of bounce back, I say move towards the body you're more familiar with. So we're not returning to anything. We're moving towards, and whether however you want to put it, a stronger, more resilient body. So it's just a shift in language and thinking. So the bounce back culture is, yeah, can be incredibly just inhibiting to healing in general. Coming back to the relaxin, once you stop breastfeeding, then you have, nobody really knows, but it's like, it can be anywhere from like a month to 4 months of where you're getting this out of your body and back to strength. One great example is Serena Williams. she's the tennis player, Olympic tennis player, right? She she was breastfeeding. She was 9 months postpartum and she was breastfeeding. And she was working with her coach and she was not getting back to her pre-pregnancy level. And what they found, what her coach had to tell her was, you won't get back to that until you stop breastfeeding. It just physiologically won't happen. So we're talking about elite. I mean, this is not, you know what I mean? Like, this is not just for people that don't exercise very much. No, we're talking about the elite of the elite of athletes, that it is a fact that when your body is nurturing another human, I think that's what we can put it into, right? That you are not going to have all of the reserves. You're not meant to, and it's okay. And it's okay. So yeah, so we say between 6 months to 2 years to really return to the body you're more familiar with. It took me, I'll be interested to hear for you, Beth, what your experience was, but with the one pregnancy I had, in 2015 was so naive still, because I was still learning all of this, that I went in thinking I was going to walk out in a little tiny like summer dress. And I looked like I was 7 months pregnant. Well, that's what they make you think. Nobody talks about that, right? Plus, I'm a Pilates teacher. I should be bouncing back like that. So 6 weeks, I was back. I wasn't back to like my body, but like my stomach was, quote, where it was at 6 weeks. So, I'm flaunting that. And, well, what wasn't happening was at like 9 months, a year, I was not fitting back into my like 5 beautiful pairs of Lucky Brand jeans. My hips were not fitting in there. And I was pissed because I'm like, what's going on? Like, I'm supposed to be bouncing, because I didn't know any of this. Like, I started learning this as I'm going through it. And sure enough, it was around that 2-year mark of being postpartum that my body was then able to fit into the jeans that I wore before pregnancy. Now, that's my body. That's me doing Pilates. That's not everybody's body. And I only had one child. So what was your experience?
I don't even remember because I had two kids very close to one another. And so, and I think that's another consideration. I had my first child, breastfed until she was like over it. And then pretty soon we were talking about having another child. So my kids are approximately a little bit over 2 years apart. So if you go back to what you were saying, up to 2 years, I didn't have that before I became pregnant again. Like I went right back into pregnancy. And then there's the other element, whether you have one child or more, that for the first few years of life, not only are they waking up at night, but that means we are waking up at night. And we know that sleep impacts stress levels, and both the combination of sleep and stress levels impact how effective our workouts can be and even our motivation. So there's that other element, let alone if someone's nursing or not nursing. And, if they're working as well, I think that's another consideration. There's a lot besides just a workout that goes into if our workouts are effective. And similar to what you were saying, the more I learn about the interconnection between our hormonal health, our sleep cycles, stress, the kids that we have, all these different elements that play into just our everyday life and how they can impact workouts. So that's done for me is take the pressure off of them. So if I am not in a place where I'm getting optimal sleep, and now it's not because of pregnancy, now I'm kind of leaning towards the perimenopause stage, then it's a different ball game now. There's that element. And I think what's helpful is knowing that no matter what life stage we are, that there's going to be different impacts that influence how we move our body. And if we really accept and honor those, I found that we can work more optimally with workouts. And this is really important. If I go back to what I mentioned earlier with like maybe some pelvic floor dysfunction, and maybe you have a better way of saying this than I'm saying it, because it is actually so common that people have pelvic floor issues and we don't talk about them
Yeah.
enough, that they just keep doing those challenging and hard workouts, which sometimes exacerbate the problem rather than scaling back, giving body time to heal, and maybe even working with a physical therapist who
Yes.
specializes in pelvic floor dysfunction. Or what do you feel is the scope of practice specifically for Pilates teachers when it comes to pelvic floor, and when we would maybe refer out and when it would be suitable for us to talk about that with our clients?
I'm so glad you brought all this up because I was totally focusing on that, the breastfeeding and I mean, yes, like the lack of sleep and the stress will hinder healing. It does. Uh, okay, so for pelvic floor and diastasis recti specifically, these are both pressure related issues. So during pregnancy, either way, both have been stretched. Okay. So I recommend number one, that all clients see a pelvic floor PT after they've given birth. And here's the thing is like we usually don't even start worrying about uh prolapse, diastasis recti until about 3 months postpartum because the body needs at least that to move around and get things back to where they're more familiar, and so when if they can see a pelvic floor PT throughout their fourth trimester, that's ideal. But if they only could have like 1 or 2 visits, I would even wait. I would go like 6 weeks and then 12 weeks and have your client come back with that information to you so you know what you're working with. Now, you can, within your scope of practice, you can teach clients how to check for the widening and thinning of the linea alba. So if we're talking about language, it's not technically a separation of the abdominals because nothing comes apart. It's just a stretching. And so what we're trying to do is bring it back with diastasis recti. With pelvic floor, we're talking about possible prolapse, possible incontinence that can be caused by several things, sometimes tightness. So while it is not within our scope of practice to touch, we can teach our clients how to assess themselves, not only with the diastasis, but also pelvic floor. And the way we do that, I'll just show you, I have this ready right here, is with a small ball. And all they have to do is place it under their pelvis here. And there's a bunch of different things you can do, but you can teach them breathing here. And if there is prolapse present, they will feel a little bit of like the description is like a golf ball or a heaviness touching, or like if they move around, if it's touching, it's definitely prolapse. If they can feel something and it comes out of the vaginal canal. And there's the 3 different types: cystocele, rectocele, and then the uterine prolapse. And it all comes through. It's just the skin basically pushes and comes into that vaginal canal. So if the prolapse is where it's like a grade, I think there's several grades, but it's like grade 2, grade 3, they'll be able to feel it on this. And that's how one of the ways you can, within your scope of practice, help somebody to realize if maybe they have something or not. And then obviously they need to be seeing the pelvic floor PT. So it's a dance between pelvic floor PT, possibly the OBGYN, and then the woman. And I think it's really important that we note that movement, just movement throughout the day, walking, the breathing. A woman might wake up with prolapse that morning where it feels like really heavy, and through the afternoon, because she's been moving and her organs are lifting, it will feel better. So there's all these factors, right? Of when do I worry, when do I not? So the rule of thumb is there's really nothing to worry about in if it hasn't cleared up by about 12 weeks, um, and then, maybe 6 months. If it hasn't cleared up in 6 months, that's definitely where, okay, then we need to be doing something about it. But for the most part, it's time. Your belly, everything was stretching for 9 months, so let's at least give it 9 months. But six weeks or 6 months is I would say, the least amount of time to be worrying about if they need to do something or not. And all of it is just a natural part of this. And like you said, the problem is that you have these ideals that it should be normal to have incontinence. Pilates, just Pilates in itself, because it's a holistic exercise, because it uses the whole body, that has been proven to help with incontinence. It's been proven to help with several different things, diastasis recti. So just Pilates in itself, when taught in moderation and modified, and really working on balancing intra-abdominal pressure, is going to be amazing for any woman. So
I'm so
does
glad
that
you
answer your
brought that
question?
up.
Yeah.
Yeah, I'm glad you brought that up because when I was a new Pilates teacher, I think a lot of what happens when we're new Pilates teachers is it's like, what else is there? We need to do more continuing education. And there is a time and space for continuing education, but especially at that time, like 2004, 5-ish, when I was doing my first bouts of continuing education, I didn't question a lot from people who I was learning from. And it goes back to I had amazing Pilates teachers that were research based when I first began Pilates. So I think I just went into with the assumption like that's what all Pilates teachers do. And you're talking a lot about research and different elements. I can hear it in the language. But I bring this up because one session that I attended, a continuing education, was all about the pelvic floor. Could we see the pelvic floor engaged? Like, could we tell when this Pilates teacher, when they were doing footwork on the reformer, engaged the pelvic floor and wasn't engaging the pelvic floor? And some people were like, oh, yes, and this and that. And I turned to someone who I knew and said, I'm not really seeing anything. She goes, I'm not either. And lo and behold, I attend a Pilates Method Alliance conference years later about the pelvic floor. And there's two physical therapists who have done research saying we actually can't see as Pilates teachers necessarily when the pelvic floor is engaging or not. It may also be outside of our scope of practice. And I thought, oh, thank goodness, because I've really never seen it. I've never really talked to it. But what we know from that research that you mentioned is that when we teach Pilates with integrity, breath is a huge element. Meeting the client where they're at, that actually fosters healthy pelvic floor rather than like engage the pelvic floor to do footwork or to do the 100 or pull up and in with the pelvic floor. Like that
Right.
has been shown not necessarily to be as effective as we thought. And I will tell you that information was very controversial for quite a lot of Pilates teachers who I was in the space with, even when they were presented with the research that it actually doesn't work in that way. The pelvic floor responds naturally to breath and movement.
Yeah.
So I'd love to know within those first 6 months in particular, after someone has had their child, is if the goal is not to get back to like full 100 or teaser or exercises that we know are going to require more like load, or I call it like oomph sometimes
Yeah.
from the pelvic floor because maybe they aren't 100% healed yet just because that process is prolonged.
Right. No, that's right on. And thinking about the research over and over again, I keep reading that women cannot differentiate the difference between the lower abdominals, transverse abdominals, and the pelvic floor. They are completely connected. In when we do a diastasis recti check, one of the ways is to hug, I use the term hug the lower abs. And there is no difference between hugging the lower abs and lifting the pelvic floor. The pelvic floor goes right along with the lower abs. That's why I'm sure why Pilates is so effective. And so, yes, definitely. I mean, that's another, story of me thinking I'm this strong Pilates teacher postpartum. And I think it was it might have been like 4 or 5 months. I still couldn't do a teaser. And, it's like, what is going on? I'm like, I had a teacher, and, she's like, you had a baby, your pelvic floor, your core isn't strong enough. And I'm just like, because I'm still buying into all the stuff I'd been told, which is, one of the biggest reasons I went in and really started to find the research and see it with my own eyes that, it takes longer, and it's okay. It's normal. So it just depends on all those factors, right? The stress, eating. I mean, are you eating? Um, then the breastfeeding. So are you sleeping, which comes into stress? So those are the factors that you can at least let your clients know, your pre and postnatal clients know, that they're give themselves at least 2 years. You can give them 2 years, then and it is a relief. It's a relief to them. Like, oh, good, I don't have to and there still is just so much out there on getting the body back. There probably always will be. And if it works for those people, that's fine. And the people that it doesn't, please explain to them that there's no pressure, that it makes it
I would
worse.
say though, for the people who think it works for them, they're also the ones who complain and have issues with back pain,
Yeah,
diastasis recti, that they have
true.
no idea about pelvic floor dysfunction. So sure, maybe they're getting
Yeah.
their physique back to where they want it,
Yes.
but their internal support is not
Exactly.
there for them. And at some point, they will need to regress or go back to simpler variations, heal. And for some people, it's so prolonged and unaddressed that it gets to then, oh, well, now we have to maybe do a surgical intervention. When if we just would have instead had more education on all regards from the medical profession and also from fitness professionals to ease back into it, when to see a specialist. And I always err on the side of caution. If you're unsure, just ask a question. But one of the challenging things is when I heard this once, it was, I forget what it was pertaining to. And I thought, but I didn't even know I should have asked that question. And
Right.
I think this is what's so valuable is that we have more information now and having conversations like this that maybe someone has never heard about it before. Well, now they can ask whoever they're working with, Pilates teacher or otherwise about it, their doctor about it, whatever it may be. And that can be so valuable. And I want to highlight that when we're saying this could take up to 2 years, it takes up to 2 years and you're not exercising during this time. It's
Right.
maybe a
Yes.
different type of intensity. So rather than focusing on what you can't do, which I think we get stuck in that rut. I remember as I was getting more pregnant, well, I couldn't get down to the floor and back up as quickly as I did before. But what
Right.
can I do? And for both of my pregnancies, I did Pilates all the way through. And I want to preface this that I had medical clearance that entire time. And I've worked with
Yeah.
clients who their entire time they did not have medical clearance to work out for whatever reason. And so they didn't see me. And other clients who did, and kind of those who in between, like partway through the pregnancy, there became some complications medically. And so we discontinued. And the point is, we want to keep parent healthy and engaged in their body. And sometimes that
Yes.
means moving with Pilates, sometimes it doesn't. And also our child as well.
Yeah.
So for you personally, did you move with Pilates while you were pregnant? And I know you have worked with a lot of people throughout pregnancy as well.
I did for sure. What I felt in the end, like the last like 5 weeks, I wanted strength training. So that's one of the things I uh, suggest to incorporate actually through the whole pregnancy and postpartum, to end all sessions standing, doing something empowering. Whether that's the free weights or maybe a TheraBand, anything where they're feeling stable. So it's pretty. I've all of these years I've tried to come up with something simple for teachers to go with, and the simplest thing I can come up with is for teachers that haven't been pregnant. Being pregnant is basically like having a humongous water balloon in your uterus. And if you feel a water balloon, it's really heavy. So stability, we talk about stability a lot. So one of the things is pregnant women, their balance is thrown off. And I'm convinced that's why. I remember being shocked actually just in my second trimester. I got off the floor and it like threw me. And I'm like, what is going on? And that's what I'm thinking. Like you're besides the hormones, just physically, you have this water balloon in your belly, and water shifts. And so it will take you to all these things. So with the hug, we teach hug the baby instead of belly to spine as a support system. And this kind of gets into one of the myths about ab work, not pregnant women not being able to do ab work. We highlight that just hugging belly to spine, with the transverse abdominals, that is ab work. And it's 100% not only safe, but necessary. If you don't use a muscle, anytime somebody says, don't do this, like another one is like, don't do adductor work. I've heard that. That's a problem because women are going to do it anyway. Through everyday life and moving, they're doing that. So we have to be conditioning the whole body. You can't be saying, don't do this, especially twisting is another one I've heard. Don't twist. So there is the truth in that is only this. Usually women will get hurt when they're twisting without support, not even thinking about it. They go down and try to lift from here without any support. That's where that twisting thing comes in. And it's not even about the baby. The baby is super safe, by the way. I know that's like one concern a lot of teachers have is like, I don't want to hurt the baby. The baby is super safe in that womb. You're not Pilates, I believe is the best exercise for pre and postnatal. And so you're not doing anything that's going to hurt that baby. So hugging the baby is what I recommend for helping women do ab work when they can no longer do your regular flexion work. Let me share a really fun fact about Pilates in itself. So Joseph Pilates created his exercises on the back, and confirm that I'm saying the right thing here, because he says this in the manifesto, Return to Life, that he does all of the exercises in a reclined or sitting position to protect the heart, to put the heart in a not so stressed place, and to support the organs. And because anytime you stand up, anything, I mean, we have to be doing every type of movement and exercise to strengthen ourselves. So with him saying that and that is true, right? Like if you're laying down, it's not stressing the heart as much. During pregnancy, the blood flow increases from 30 to 50%. Okay. So the heart is working that much harder. Plus you have the veins and the arteries, it's slowing down because of all of the hormones. So Pilates, when you're doing things in a reclined, once baby gets really heavy, then you'll bring him heart above baby. Once you're doing that sitting or in the incline position, you can be sure that what you're doing is super safe. And then we get into staying close to the midline. So like not taking movements way out. You want to stay close to the midline. Uh, Generally lighter weight. So I say like standard to lighter weight, because again, you've got the ligaments are not able to, and this is why it's not, you get up slower. They are not as bouncy as they are when we're not pregnant. So a little bit slower, a little bit lighter will not put like a strain on the body. I kind of went all
I
over the
love
place
that.
there. Yeah, take it
No,
back to
thanks for
what,
sharing, because another thing that the supine position is, or that elevated recline position, so it may not be completely flat on back, but have some elevation. I mean, you teach a lot about the different options for the equipment and on the mat in your program, I know, is that it actually engages the parasympathetic nervous system compared to seated or standing engages the sympathetic nervous system, for those of you
nice.
who are familiar with that element. And I wanted to add on another myth that I've heard that was shared to me by another Pilates teacher, and that is she heard from someone else that she never teaches exercises prone on the front side because that could be harmful for someone who's pregnant. I was like, what? I would ask for the research behind that. There, not that I know of, no. For most people who are pregnant, they will know when, yeah, it doesn't really feel
Yeah,
comfortable to lay on my front side. And then we're going to do back extension in a different position. But to across the board say, I'm never going to teach anything laying down again is just not beneficial, I
yeah,
feel like, in a very fear-based way of teaching. And then all of a sudden, we start limiting how we teach a movement repertoire, which you alluded to, that we do these movements all through a day. And I found what research more shows is that the more people eliminate movement, that actually causes more dysfunction than moving in diverse ways. Now, not
right.
saying we move in ways that aren't suitable for our body and safe for us, but we want to look at those variations that are optimal. And I think that's a good segue in to what you do and why you do what you do, having such a huge, I mean, I think it's evolved over the years, and it
Yeah,
where your course started for the perinatal population as far as Pilates teacher education has really expanded. And this is something that was an invaluable part of my teacher training, or continuing education, I should say, the perinatal population, is because it worked for me personally. It helped empower me to teach other people, because here's the thing, is my experience with my pregnancy is only my experience. And I
yeah.
was really fortunate at the time. The Pilates studio I was working in, like, we were all kind of pregnant within the same five
Oh,
years of each
cool.
other. And for me, when I was pregnant, I was like, oh yeah, I really need to work on that, what I know from you now, hug the baby, to stabilize, because otherwise my back was not having it.
Yeah.
Whereas my colleague, she's like, oh my gosh, I just love being pregnant. I feel so much more stable. My back feels better now than when I'm not pregnant. I'm like, you
Wow.
are what? That's not true for me. So even for those of us who have been pregnant, it's only either the one time we were pregnant, or for me it was two, or maybe for someone else. I know people have been pregnant like 5 times. Like,
Yeah,
it's only our personal experience. And I think that's where this course is so valuable,
yeah.
because I also have heard people say, oh, it's really easy. You just like, these are
Yes.
your like 5 variations. I'm like, oh no, we need to go a little bit more nuanced than that. And I think that's where you go a lot more nuanced, but also with empowering language, because the more options we have as
Yeah,
Pilates teachers, I feel like it just provides a more supportive environment for the people who we work with.
yeah. Yeah. So that this program, yeah, it's done several variations of it, moving up to now. I just mapped out a plan of like how long, what is the minimum amount of time it would take. And I've mapped out the minimum amount, like going like every 2 weeks with everything is 90 days. You could do it in 90 days if you're really focused and on the ball. Uh, because here's the thing, and a lot of the problem is that you have a lot of these pre and postnatal weekend specialists trainings. And let me tell you, Beth, the majority of my students have already gone through that training, and they're in the Pregnancy Pilates Impact Academy because they are still not confident. They're not qualified. And so what we try to do is it's kind of like college. Like you have to ease your way. And one thing I do is very soon, if you're already a certified Pilates teacher, you can work with pregnant women. There's no law that says you can't. So as soon as you're comfortable and you have what you need within the first 15 to 30 days, I help you not only find pregnant women, but you need to be teaching them. You need to be practicing. So rather than the weekend training that throws everything out to you, and then it's like, hey, see you later, good luck. I'm helping you through all these little nuanced things that you don't know until you're actually working with a client. You have to practice. You have to be working with them. That's the only way you get more comfortable at it.
Thanks for bringing that up because I think this is just a generalization from people who have gone through the trauma informed Pilates approach course that Pilates teachers, we for our continuing education, exactly like you're saying, are trained to do this weekend workshop style continuing education.
Yeah.
And I have to tell you, it just doesn't give time for us to fully understand and integrate it. Now, let's take it back to the day when, like, Allison and I were first Pilates teachers. That was the only option available. There
Right.
was no online platform. So maybe it made sense
Yes.
in that way
Point.
because if someone's flying to a location, which was the reality back then, it was
Yeah.
harder to take continuing education or even become a Pilates teacher, that it made sense to cram it into one weekend. And same with my course, some people want to get it done fast because maybe they have CECs coming up. And I'm always like, let's take it a week at a time so you can think about it, reflect, put into action, um, practice what you're doing so that you're actually learning. And it's not just like a check the box for a continuing
Yes.
education course. And that's where the true value lies. So I love that you bring this up, like just spread it out a little bit more. And correct me if I'm wrong, but I'm pretty sure your course is like mine, where once they invest in it, they can come back to it. So
Yeah.
if they need a refresher on something, whereas the workshops back in our day, I'm like I kind of remember that exercise variation, but I kind of forgot it. I I don't really have anyone way to ask because it was 10 years ago, but with yours they can go back in and watch those lessons again. Is that right?
They get lifetime access. And actually starting, I've never done this before, and I'm starting in July. You actually encouraged me thinking about what you do now with your mat certification. For the first time ever, starting July 1st, I will be taking students through the entire course. I haven't decided if we're going to do 90 days or if we're going to do like 5 or 6 months, but it's something I'm really excited about in this online space. The program initially was go at your own pace. And I did that on purpose because I didn't want teachers to feel like they were behind. I never that It's such a like pressure, you know. And so that's why I always did it like that. And I just offered like calls for people to ask questions. But there are like a good handful of teachers who have had the course for years and haven't completed it because they don't have that the ability. There's nothing wrong with it. Everybody learns differently. So I wanted to offer those teachers, and then any new teachers that want to come in and get this done, a guided study where you know that from this date and then the end at this date you'll graduate. And I'm really excited about that because it gives us a chance to really dig into the material, do updated information besides so it works like this. You have the foundations, and then you have equipment and mat. So if you just teach mat and props, you have that. If you teach both, you have equipment also, all pieces of basic apparatus. And then we also have your specialty courses. So we have the Pilates protocol for diastasis recti, the resilient perinatal pelvic floor. I have a body image course. Oh, I'm talking about like freebies earlier. I have a freebie called the Body Patience Guide for pre and postnatal women, for teachers to help educate their clients. So we can give you all that, in the notes. So we've got, yeah, all the different things. What's the other one? Oh, 34 mats. So I've taken all 34 of the classical mat exercises, including the contraindicated ones, and we have created pregnancy and postpartum variations for those. So it's it is like your university for learning pre and postnatal. I want teachers to be super confident. There's a lot of personal development and professional development, learning about business weaved into all of that. So, the idea is they come out and are like ready to go, whether it be with the pre and postnatal specialty, but also just in general more confident as a teacher, as a person, you know. So that's the gist.
I love that. So with this new iteration, it has all of the online course. Do you envision that you'll be offering this more like in real time, like lineage through your course, like maybe once a year, twice a year?
Probably, yeah. I'm thinking I'll see how I do, because it's an energy thing too, right? Like it'll take a lot of time and planning from me. So I'll see how it goes. I'll at least do it once a year. At least once a year, I can see myself doing it. I really like that platform, or that way of conducting a course. There is just so much more personal than just having somebody do it on their own. And I really want to be able to offer that now.
Because right now, people can enroll at any time. Is that right?
They can, and yeah, at this point, yes, it is open enrollment or rolling enrollment. Why somebody might want to get in now is because we'll be starting the guided training July 1st. Yeah.
Yes. 'Cause so here's an example. I am doing a current course. It was like a 20-day tune-up course. And my plan was to complete this like during a 1 month time. I bought it 1 month prior and I knew, okay, next month I'm going to get to it. I'm still working my way through it because there isn't that deadline. I don't
Yeah.
need it for my continuing education as a Pilates teacher, health coach, or group fitness teacher. It's for a different element. And like, okay, I have to get back to it. I have to get back to it. And I feel like a lot of people experience that if they're
Yeah.
not submitting your course, for instance, for their
Right.
NCPT,
Yeah.
where there's that deadline every, what, I believe it's about 2 years,
Yeah.
that
Mhm.
sometimes it can go off to the side. So I think this is a beautiful hybrid model
Yeah.
to offer for someone who maybe, in a few months from now, they are wanting to get on the course because they know that they're going to be pregnant or they want to focus more on that professionally, but also knowing that either right now or in the future, there is going to be more opportunities for connection, which I think is an amazing element to bring to your program that's already so robust. So before we head off today, anything else that you want to share? Words of wisdom.
Uh, I think just as a teacher in general, it's like once you have the basics, start to make it your own. That's what I've found it really builds the confidence in general. Is okay, I know the basics, I know how to keep clients safe, so how can I tweak this for this particular client or myself? The other thing is you have to be doing it on your own. Like I have all the pieces of equipment here, and I go to Club Pilates because they just opened one down the street, because I need guidance, a teacher to motivate me. I need the motivation. So you want to be, if you're not self-motivated to do a full workout, and I am not, obviously, then find a studio, or maybe you have like a friend that will do it with you. Sometimes I would do that with Sunny. We used to like get on Zoom and we would do it together. Anything, you have to be doing it. You have to be doing the thing that you teach, and just believe in yourself. Like anything is possible, and you're amazing, and you're doing a beautiful thing teaching Pilates.
Thanks so much, Allison. That was a beautiful statement. And what I appreciate is mentioning continue with your personal practice because I
Yeah.
think for most Pilates teachers, it gets lost, specifically in the first kind of few years or as we start growing our own families. It can get lost. It turns into just a job. And I found as
Right.
well when you know your foundation and you can kind of use that as inspiration for where you're going to take it for you, really the perinatal population. And let's face it, a lot of the options you're teaching are not only good for the perinatal body, but good for anyone who comes to
Yeah.
us.
I always tell teachers the other thing is like anything you're teaching or learning to teach, I always tell my students, your clients, all these exercises, because one of the things they have to do is they learn the exercise, they go teach it, and I tell them to the next client, they don't have to be perinatal. You can teach the same exercise and it's amazing for really anybody. You're just I always just say just don't say hug the baby. I say hug the belly. Hug the
Yeah.
belly. And definitely don't tell men that you're that you're doing a pregnancy. Maybe they wouldn't care, but yeah, so that's what I recommend is you just got to practice, you have to apply and do it for yourself. Make sure you love it. And if you're like in a program or something that's making you feel less than and not inspiring you to thrive and bloom, then that's a red flag, and you don't want to deaden your love for Pilates because of that.
Yeah.
So thank you,
So,
Beth.
last question. Where can people find you and your work?
Okay, so I have a website, www dot, you have to put that in, pregnancypilatesimpact.com. And then Instagram is where I post a lot of educational videos, inspirational videos, thought provoking, and that's just at pregnancy.pilates.impact. And send me a message. I love getting DMs and just learning about what teachers need. And thank you, Beth, for everything that you're doing. You are an inspiration to me. So
Oh, thank you, Allison. Thanks so much for being here, and hopefully you all will connect with her either via website and or on Instagram. Bye.
thank you. Thank you, Beth.
I don't know about you, but I felt that conversation was so amazing. If you found it valuable and insightful, give this video a thumbs up, drop a comment down below, or you can even leave a question and share it with a friend or colleague. For more information about Allison and Pregnancy Pilates Impact, check out the links below in the video description. I hope that you have a beautiful day and you're inspired to keep moving with Pilates.